Anxiety is an intense or persistent worry and fear about everyday situations. It can be associated with increased heart rate, rapidly breathing, sweating, and feeling tired. Anxiety can be normal in stressful situations, such as publicly speaking or when you're about to give an exam. Anxiety is only an indicator of any underlying disease or pathology. When these feelings become very excessive and such consuming on such a level that they interfere with one's daily life and activities. When such feelings they interfere with a person's daily activities and functioning, this is called an anxiety disorder. A generalized anxiety disorder is a severe ongoing anxiety that interferes with daily activities. Patients with signs and symptoms of anxiety, their anxiety can, if it is either due to a very brief reaction to any stressful event, then you can consider it as an adaptation disorder. Like if there was any stressful situation and they had problem adapting to it, so that is why they felt anxious. If their anxiety issue was not related to any short term stressful event, then it might be a consequence of any illness. If it is a consequence of any illness, the mental disorder can be caused by this mental disorder, it could have been caused by any physical illness. If it wasn't caused by any illness, then it could have been due to consumption of alcohol or any other substance. If it was due to any drugs or alcohols, if the person consumed any alcohol or any other substance, then these could have resulted in him being anxious. If no such case was there, then the symptoms could be related to any psychotic or depressive episode. And if there was a psychotic depressive episode, that could lead to a being categorized in a mental disorder. And if all of these were not present, then the feeling of anxiety of that patient could be related to primary anxiety disorders. Now, some of the primary anxiety disorders, they are first is PTSD, post traumatic stress disorder. If a person re-experiences any traumatic events, like they're happening again in front of their eyes and they're reliving it, then this could be considered a case of PTSD. Second would be phobic anxiety disorder. If a person has a fear for objects and situations, it could be a fear of darkness, fear of any object such as a knife, sharp things. Some fears could even be very lame for normal people, but they can have disastrous mental effects on a person who has a phobia related to them. So that primary anxiety disorder would be phobic anxiety disorder. Third one is OCD, obsessive compulsive disorder. In this disorder, a person, he feels like he's very compelled to do certain things. Like he feels like he needs to maintain absolute hygiene around them. They need to keep on washing their hands over and over again. If they have arranged something in a particular manner, then it should stay in that manner, and if it is disturbed, even in the slightest manner, then they would constantly be occupied with that thought, they would be obsessed with the thought of rearranging it and to it back to its place. So that would be obsessive compulsive disorder. Now, the other one could be a panic disorder. Like any sudden attack of anxiety or fear could be considered as a panic disorder. Generalized anxiety disorder, that, as I said earlier, it is an apprehension about every little thing and multiple complaints about everything. That could be considered generalized anxiety disorder. And a sad mood can be related to a combination of all these disorders, like a combination of anxiety, depression, and any other disorder that could lead to the person having a sad mood. So these were some of the primary anxiety disorders.